Good day, ma'am. I am Stephanie A. Lee, your student nurse from J.H. Cirilia State College, Pagadian. For today, I will be assessing nose and sinuses. First and foremost, gather all the equipment needed. What we are going to need are pen light, otoscope, and nasal speculum. I have washed my hands before coming to my patient. I already gathered my equipment and it's already cleaned. I have observed appropriate infection control, and then the room is well lighted for this assessment, and the client's privacy is already well attended. Hello ma'am, my name is Stephanie Lee. I am a student nurse from J.H. Cirilia State College, Pagadian, and I will be assessing you for today. Before we get started, are there any vision or hearing impairments that may hinder the assessment today?
None.
Okay. Can you state for me your name, birth date, and address, please?
Maiden J. A. Navarra, January 5, 2001, San Jose District, Pagadian City.
Okay, thank you. What we are going to do today is I will be assessing your nose and sinuses. So I will be looking and feeling the outside of your nose and gently looking in the inside of your nose. Is that okay with you, ma'am?
Yes.
Okay. Everything that will be done here will remain confidential, so you don't have to worry about it. Only me and the rest of the healthcare team who are attending your proper care will be the one to know this assessment. What you will do, ma'am, is to sit comfortably and relax your body. So we will start by asking you questions. Do you have allergies?
No.
Okay. Are you having difficulty when breathing through your nose?
No.
Okay. Are you experiencing sinus infections?
No.
Okay. How about injuries in your nose or in your face?
No.
Okay. Nosebleeds?
No also.
Okay. Are you taking any medications right now?
No.
Okay. Are you experiencing changes in your sense of smell?
No.
Okay. Now I'm going to start my physical examination now. First, inspect the external nose. So, I am looking for the shape of the nose, if it's symmetric or asymmetry, and if there is any skin lesions or inflammations in the nose and on the nostrils. I should also look for the size of the nose, if it's normal or abnormal, and lastly for the color. So the color of the nose is the same with the rest of the face. The size is normal and I can't see any discharge from the nostrils and inflammations or skin lesions on the nose. And as for the shape, it is symmetric. So I am going to palpate your nose. Please tell me if you feel any pain. Okay, so we're going to start at the bridge of the nose. Write down the bony parts, and then the cartilaginous of the nose, and the movable part of the nose. You have to check if there's any deformity, any pain or tenderness on the nose. Okay, so the nose is smooth and symmetric with no tenderness upon palpation, and my client reports no pain. Ma'am, please close your mouth and kindly block one nostril and breathe through the opposite nostril. Okay, the other one please. Okay, the purpose of what I'm doing is to determine patency of both nasal cavities, if there is any nasal obstruction, so that I can know if the air moves freely as the client breathes through the nostril. There's no nasal obstruction, and my client was able to sniff through each nostril while the other nostril is closed. I don't have an otoscope, so I'm going to use my pen light to inspect the nasal cavities of my client. I'm going to look inside your nasal cavity, so please tilt your head back. I am checking for any deformities on the nasal mucosa, nasal septum, and nasal turbinate. The nasal cavities of the client is free of swelling, foreign objects, and bleeding. to conclude, the nasal mucosa is dark pink and it is moist and free of exudate. The nasal septum is intact and free of ulcers or perforations. And for the turbinates are pink. It is redder than the oral mucosa. It is moist and free of lesions. Okay. So next, palpate sinuses. Okay, so I'm going to place my thumb just underneath your eyebrows. And then, please tell me if you feel any pain, okay? So, I am palpating the frontal sinus. Okay, next. The maxillary sinus. If the patient has an infection in the sinuses, the pressure will cause pain and that is an indication of sinusitis. Okay. Both the frontal and maxillary sinuses are non-tender to palpation, no crepitus is evident, and the client reports no pain. Lastly, percuss sinuses. Okay. Lightly tap over the frontal sinuses and at the maxillary sinus. Okay. The sinus are not tender on percussion. So that concludes my assessment. Don't forget to document all your findings in the patient's chart and inform the doctor or nurse on duty if there are any abnormalities found. So, ma'am, thank you for your cooperation. That would be all. God bless.